Welcome to Advanced Musculoskeletal Medicine Consultants. My name is Dr. Patricia Delzell. Through this slideshow, I will introduce our practice, what we do, and how we do it. I was initially trained in a traditional radiology program. I have worked in both academic and private practice. I was the director of musculoskeletal ultrasound, which is my subspecialty at the Cleveland Clinic for 10 years prior to opening this practice. I also have an integrative medicine fellowship as well as an integrative pain medicine certificate. Because of my dual training, there's a variety of services which we provide at Advanced MMC. Combining conventional and complementary treatments enhances the options available to treat patients with chronic musculoskeletal pain. Treatment plans are individualized to optimize long-term healing and increase quality of life. As a radiologist, I started looking into integrative medicine because my patients were not seeing long-term results from the injections. I began working with ancillary staff and referring practitioners to start addressing underlying causes for the patient's pain. Integrative medicine allows physicians to think about practicing medicine from a different vantage point, approaching disease from an underlying cause, lifestyle, and environmental approach. When dealing with chronic musculoskeletal pain, there can often be an underlying biomechanical issue related to scarring. Scar tissue restricts tissues that need to move freely. Scar tissue forms as a part of the healing process. It most commonly forms when the soft tissues do not have the oxygen they need to function properly. This can occur after injury, surgery, or more commonly from repetitive stress or overuse of certain soft tissues. Normally, the healing process results in normal healed tissue. When the healing process is disrupted or incomplete, scar remains in the soft tissues, resulting in chronic musculoskeletal pain. Scar tissue does not have the same flexibility as healthy tissue and can result in limited range of motion and altered biomechanics. Painful nerve endings have been found in scar tissue. So while the scar tissue itself can be painful, when it is adhered to surrounding soft tissues, moving the structure can cause increased pain as the scar tissue is being pulled on. Using ultrasound, we can demonstrate the scar within different soft tissues. In this example, the blue arrow is pointing to a focal area of stellate scar within a muscle, as outlined on the screen. A different kind of scar can form between the muscle and the overlying fascia. The red line is indicating a thickening of fascia overlying the underlying muscle. Fascial scar can also form over tendons. In this image, the tendon is being outlined in red, and the thickened fascia is seen overlying it. Scar can also form in fat pads around different areas of the musculoskeletal system, which can be painful in and of itself, but also can adhere to surrounding tendons. Fat pad scarring can actually cause symptoms similar to chronic tendinitis or tendinosis. Ultrasound is important for identifying the difference between fat pad scarring and tendinosis so the appropriate treatment can be performed. In this example, there is black shadowing scar within the fat pad underlying the Achilles tendon, which is outlined here in red. Scar in the fat pad can attach itself to the adjacent tendon and pull on it when the limb is moved around. Using ultrasound guidance, a needle can be advanced between the tendon and the scar and fluid injected. On the right-hand side, the star shows the fluid between the scar and the tendon. After the injection, dynamic exam can be performed to demonstrate there is no longer tethering remaining to the tendon. There are a lot of chronic changes that occur in our body over time. We can see these changes on MRI and on ultrasound. However, just because the chronic changes are there, it does not mean that that is what's causing the patient's pain. In this example, this elderly gentleman who was very active had a high-grade tear of the hamstring and associated pain. He also had a chronic ligament sprain and muscle atrophy. Even though the imaging findings were moderate to severe, the patient responded well to conservative, conventional treatment as well as integrative treatments without the need for injections, needle therapy, or surgery. By 3 months, his symptoms had improved by 95%, and he was able to go on a very extended bike trip with his son without any symptom aggravation. As I stated earlier, the treatment plans are individualized and created in a team approach. 80% of patients experience a significant improvement in symptoms and quality of life when the treatment plan is followed. Thank you for watching my slideshow. If you feel that advanced MMC can help you with your chronic musculoskeletal pain, please call the office for an appointment. We look forward to helping you on your journey to healing.